aspect of your face would you like to rejuvenate?
This is an area of concern for me, right here. I feel like I'm a little bit liney and crepey, and I've got a little bit down here that bothers me a bit.
This is more crepey skin with a slight deficit. Obviously the regeneration has to be way more subtle and more superficial. Selphyl, which is a platelet-rich plasma, will be injected. We'll take your blood, spin it down, take off the plasma, and in the plasma will be mainly platelets.
Okay.
The red blood cells will spin down, the white blood cells will be filtered out, so we don't get either bruising or bleeding, we don't get inflammation from the white blood cells, we get just the platelets.
Okay.
They will then, after a time, release their growth factors and cause and stimulate collagen growth. Thicken the skin, stiffen the skin, and slowly fill it.
Okay.
Okay, so this is your plasma. Those are the red blood cells. These are the red blood cells without oxygen, they're purple. Red blood cells with oxygen are redder.
Okay.
This is the plug. This is the patented difference between this Selphyl platelet-rich plasma matrix system and other PRPs that are not Selphyl.
Okay.
They don't have as good a plug mechanism which keeps the red blood cells and separates them. We are ready to activate the PRP, the Selphyl PRP. The plasma, the platelet-rich plasma, is now flowing into the tube with the activating ingredient.
You're not sure you want to go.
Oh, you look like you've been crying.
I think it's time to take a break. Your allergies and stay home to eat.
Quick and painless. Okay, so here I am post Selphyl treatment. My eyes are a little bit swollen, and I guess I can expect this for a couple days, but this is sort of the response you want, and yeah, just to avoid as far as touching the area too much, and rubbing. No rubbing, so definitely just want to leave things to initiate the inflammatory response in this area. So yeah, I feel fine. I mean, I know I don't look great, but the after effect of this will be very, very good results indeed. And I've got, I think, another 2 treatments after this. So they're spaced 4 weeks apart, with the optimum treatment being 6 months out. And they'll just get rid of that crepiness and nice texture under my eyes. So I'm looking forward to that. So 2.5 weeks ago, I had my Selphyl. Immediately following, I had a little bit of swelling and puffiness under my eyes, and within 24 hours, that had decreased a bit. And then by 72 hours, so by the Monday, I had it done on a Friday, by the Monday, you could hardly see anything at all. A little bit tender to touch, but the results, you know, the actual treatment, post-treatment was excellent. So following my Selphyl treatment, the one area for me, I had quite a bit of crepiness and wrinkles under my eyes, and I will say that probably about a week after the fact, I had noticed that the texture under my eyes had changed. The skin was just a lot more supple and full, and so I'm very pleased with that result, and certainly the wrinkles, the fine lines have seemed to decrease a bit. So I'm thinking that, you know, my treatment number 2 and number 3, following that, that'll, you know, almost be obsolete. So really looking forward to that. Great Selphyl. I love Selphyl.